At Yoga Factory, we tell students that by doing the 26 and 2 yoga class, they will bring more range of motion to their shoulder blades and help relieve most back pain. From a doctor's point of view, how accurate are we?
You are 100% spot on. Okay. And you know, the shoulder joint is, it's one of the more complicated joints. It's not like the knee, which is a simple hinge, or the hip, which is a ball and socket. The shoulder joint has all these soft tissue muscles that attach to it. And if you think of how most of us spend our days when we're not in this room, writing, reading, drawing, working at a desk, computer, we're forward and looking down, and we're restricting, we're not doing much extension. If your cervical spine isn't aligned and healthy, your shoulder range of motion is restricted permanently to some degree. And if you think about it, for the people that aren't doing the things that we're doing in this room, most people lose 1% of strength and joint range of motion a year over the age of 25 or 30. Now 1% doesn't sound like a lot, but that's the difference in allowing people to age and think that it's normal to walk the way, you know, to live the way he was in that unhealthy posture. It's simply not healthy. It's a loss of function a little bit over time. And you're 100% right. If you get somebody's shoulder range of motion, you're putting active years of health in front of them. There's no question about it.
Let's see what the shoulder blades are doing in half moon posture. The shoulder blades move a little in the beginning, but when she really stretches up here in the setup of half moon, you'll see there's lots of space created in between the vertebrae for more blood circulation. What's interesting is that we do this in the class so much, we lift before almost every one of our standing postures.
It's a great point. It's a great point. And I said you're totally anatomically 100% accurate. Yeah. So in our thoracic and lumbar spine, the lower portions of the spine, our disc spaces are very small. You know, we have bone on bone separated only by an intervertebral disc. And that disc has a small arterial blood supply, but it's often inefficient to fully perfuse the disc over time. And the point I'm making, there's a term, it's called imbibition, and it refers to how the discs get nutrients and release toxins in the environment that they're in, and it all has to do with normal flexion and extension of the spine to create the motion on the disc to wring it out like a sponge to release toxins. It's literally, if you think of a sponge in a bucket and it would absorb water, that the disc is doing that when you create that space. That disc in the lumbar and thoracic area are taking in oxygen from the tissues in that area, and then when you constrict it, it's releasing toxins. And so the point is, that's how a healthy disc grows, stays healthy, releases waste, and takes in oxygen and nutrients, and it's dependent on spinal range of motion. Because the arterial blood supply to the disc is not always adequate. And so for people who lose function, have decay, don't have the range of motion, those discs cannot remain healthy, and they don't get all the nutrients that they need. And when that process continues, you can see fusion and further decay and degeneration and badness. So that whole process is really crucial, and that's exactly what's happening in the postures. And she demonstrated it beautifully. You could see how much more space there was in her spine.